Hello, class. We're going to talk today about chapter 14 in your book, which goes over hormonal disorders and their treatments. There's a lot of information to cover today, so just bear with me. I'll try to get through it pretty quickly so we're not sitting here for an hour. So the chapter topics will cover the endocrine system, thyroid disorders, male hormones and sexual dysfunction, female hormones and sexual dysfunction, hormones in transsexualism and sex reassignment, pregnancy and childbirth, osteoporosis, adrenal gland disorders and corticosteroid therapy, diabetes, growth disorders, and complementary and alternative therapies. Our learning objectives are to summarize the concept of hormones and how they regulate the body, explain the treatments for disorders of the thyroid, discuss adrenal sex hormones and male erectile dysfunction, outline the concept of hormone replacement therapy, distinguish the various formulations of oral contraceptives, outline the drugs used urgently during labor and at delivery, describe the diseases of the genital systems and how to avoid them, list commonly used corticosteroids, summarize diabetes and the proper treatment of and care of patients, state applications for growth hormone. So I think this topic of hormone disorders and their treatment is especially interesting because almost all of us, I would say, know someone or are the person who is suffering from some sort of um, hormonal disorder. If we aren't now, we're almost all guaranteed to at some point in our lives as we age. So I think this topic is especially interesting because it's applicable to so many people. So the first thing we'll discuss is the endocrine system. Here on the left is our model of a man here, and it discusses the different glands that are included in the endocrine system. So it consists of glands and other structures that produce hormones. Hormones are responsible for specific regulatory effects on tissues and organs, and they target the tissue affected by a hormone. So it's just a continuation of the endocrine system. We have a model here of the nerve connected to the hypothalamus, and then all of the different areas that it affects. Thyroid disorders are actually more common than you would probably think. When you work in retail pharmacy, you'll probably be surprised at how many people are on a thyroid supplement. Hypothyroidism is probably your most common, but it conditions in which the production of thyroid hormones is below normal. Different things can cause it, including autoimmune destruction of the gland, radioactive iodine therapy, surgical removal of the thyroid, and pituitary or hypothalamus dysfunction. So if you suffer from hyperthyroidism or enlargement of the thyroid, and you have your thyroid removed, then you'll have to take a thyroid supplement pretty much for the rest of your life. So like I said, there's a lot of different people on levothyroxine, which is one of the major thyroid supplements. Here we have the treatments for hypothyroidism. Levothyroxine, as I mentioned earlier, there's Levoxyl and Synthroid. Those are your two most common ones. And then liothyronone, that's not quite as common. Hyperthyroidism is a condition in which the thyroid hormones are produced in excess, and it's also called thyrotoxicosis. It causes Graves' disease and thyroid nodules or tumors, pituitary nodules or tumors. Graves' disease is a condition where there's pressure that it builds behind your eyes, and it causes a bulging of your eyes as you age. If you have ever heard of Marty Feldman, he was a comedian. You can look him up. He had Graves' disease, and his eyes were very bulged and pronounced. Symptoms include weight loss, hair loss, exophthalmosis, fat collection behind the eyeball. It causes protrusion in the eye and may lead to corneal ulceration, as I mentioned before. Treatment for hypothyroidism, one is surgery, which you could remove and reduce the function of the gland. Ablation or destruction of the thyroid gland via radioactive iodine. Short-term suppression of thyroid hormones. Methimazole is one of the ones that you'll see most commonly used for hyperthyroidism. The brand name there is Thymol. Or oral thyroid supplementation, which is given to artificially provide adequate hormone levels after surgery or ablation. As I mentioned earlier, if you have it removed or if you go through ablation and it's destructed, then you'll have to take a supplement for hypothyroidism. So methimazole, as I mentioned earlier, is thymol or tabazole, and it treats hyperthyroidism when surgery or radioactive iodine aren't appropriate. So identify whether the following medicines are used in hypothyroidism or hyperthyroidism. The levothyroxine and liothyronine is hypo, and methimazole and propylthiouracil is hyper. Now we'll get into male hormones and sexual dysfunction. The major male hormone that we'll talk about is testosterone. I'm sure we're all familiar with testosterone. We've all heard about that one before. The function of that is to initiate the initiation of sperm production, behavioral characteristics, libido, sexual potency, fertility, muscle mass and strength. There are disorders of male hormones called hypogonadism. It's a condition in which the body's sex glands produce little or no hormones. Symptoms include breast enlargement, muscle loss, and decreased libido. And the treatment consists of different androgens. Erectile dysfunction is the failure to initiate or maintain an erection until ejaculation. It can be caused by a testosterone deficiency, alcoholism, cigarette smoking, psychological factors, and medications. Actually, this is a side effect of a lot of different medications for depression. And there's multiple drug therapy options for treatment. We'll go over the testosterone and Cabreject, which is used in the treatment of impotence. We've all heard of Viagra, Levitra, Cialis. We've seen commercials on TV for those. The Stendra is a new one, but they're all in the same drug class. If a drug ends in AFIL, most likely it is going to be used for the treatment of erectile dysfunction. An easy way to identify a PDE5 inhibitor is to look at the ending of the drug name. You'll find that the PDE5 inhibitors end with AFIL, as I mentioned earlier. Female hormones and sexual dysfunction. Women have to go through that as well, especially as we age. We have decreases in estrogen and progesterone. So estrogen refers to a group of hormones formed in the ovaries, and they can cause all kinds of problems when they get out of balance. An estrogen deficiency, symptoms include irregular bleeding, irregular cycles, vasomotor symptoms, atrophic vulvovaginitis, etc. There's a lot of different treatments, including hormone therapy. Menopause, it's all inevitable. We'll probably go through that at some point if we live long enough. The cessation of menses for 1 year. So it usually hits women when they're in their early to mid 50s. The decline in estrogen production accompanied by irregular bleeding before menses terminates. Symptoms include vasomotor instability, drying and atrophy of vaginal mucosa, insomnia, irritability, and mood changes, also hot flashes. Hormone therapy is often given to ease transition into menopause. Progestin refers to a group of synthetic forms of progesterone. These can be given as supplements. Hormone therapy. Their supplements are not interchangeable despite having the same ingredients. Estrogen plus smoking increases risk for blood clots. That's why there's labels and warnings on estrogen supplements to not smoke while you're taking estrogen. The guidelines for use is based on evolving research, which include management of vasomotor symptoms, limiting use to the shortest time period possible, and is not recommended in patients with a history of breast cancer or family history of breast cancer. Risks and benefits different for each woman, and they should be tapered if used long term. Estrogen-only hormone therapy products, conjugated estrogens such as Premarin, and then there's estradiol. There's a lot of different brand names of estradiol. Premarin is actually made from conjugated estrogens from pregnant mare urine, so there's been some debate on whether that is an ethical treatment or not. Progestin hormone therapy products, such as progesterone, most of them all come with the increased risk of breast cancer, and that's just heightened if you are a smoker. Conjugated estrogen and medroxyprogesterone combinations. There's Prempro, Premphase. There's a lot of different combinations of estrogen and progesterone. Female sexual dysfunction. Symptoms include decreased desire, reduced arousal, anorgasmia, and pain. Treatments include counseling, lifestyle changes, vaginal lubricants and moisturizers, androgen therapy, and antidepressants. Here's different treatments for female sexual dysfunction. Hormones and transsexualism, sex reassignment. It's important to be familiar with the correct terminology for this, just so we can all be aware, because you will have customers or patients that come into your pharmacy that are undergoing sex reassignment surgery, and you want to be able to use the right terminology. So transgender is experiencing a gender identity that's inconsistent with one's somatic sexual differentiation. It may be expressed through clothing, hairstyle, or mannerisms. Gender reassignment is permanently transitioning to the gender of a person which they identify with. It may include hormonal, anatomical, and psychosocial changes. Transsexual is a person who chooses to go through the process of gender reassignment, and the goals of hormonal therapy include suppressing the hormones of an individual's native sex and introducing characteristics of an individual's reassigned sex. Female to male gender reassignment, also referred to as FTM, includes testosterone preparations, which have some side effects. It can produce oily skin, facial and body hair growth, balding, increased muscle mass, redistribution of body fat, loss of menses, and there's some other ones down there. There's different side effects as well. This is increased red blood cells, weight gain, acne, sleep apnea. Your book goes into more depth about the different side effects of taking testosterone. A male to female, or MTF, gender reassignment is introduction of estrogen, progesterone, progestins, and anti-androgens. And the effects of introducing these are changes in body fat redistribution, decreased muscle mass, softening of the skin and decreased oiliness, declines in libido and erections, breast growth, shrinking of testes and decreased sperm production, thinning and slowed growth of facial hair and body hair, and male pattern baldness. There's also some side effects here of weight gain, cardiovascular disease, and hypertension. Pregnancy and childbirth. We'll talk about contraception, which is any practice that serves to prevent pregnancy during sexual activity, and the different methods of contraception. So we have non-pharmacologic, abstinence and natural childbirth, and pharmacologic, oral contraceptives, barrier methods, transdermal and vaginal contraceptives, injections, implants, and intrauterine devices. One is a male condom. Then we have the female condom and diaphragm and cervical cap. And then there's medications, which would be birth control. There's different cautions and considerations. There's controversy about whether there is increased cancer risk in women with history of breast, endometrial, ovarian, and cervical cancer. And advantages of products containing only progestin, which lower hormone doses reduce side effects such as headaches and elevated blood pressure, and may be used in patients for whom oral contraceptives are typically not appropriate. Smoking in conjunction with hormone therapy increases the risk of heart attack and blood clots and stroke. And the disadvantages of products containing only progestin, if you miss a dose, can affect your failure rate more quickly than products containing estrogen. Oral contraceptives also don't prevent transmissions of STIs. Just some different emergency contraceptives here. We've probably all heard of Plan B, One Step, Next Choice. Those are just different emergency contraceptives, or the day after pills, they're also referred to. Or other hormonal contraceptives include transdermal contraceptives and vaginal contraceptives. Injections such as Depo-Provera, and implants such as Implanon, which actually goes in your arm. Other hormonal contraceptives, these are just different hormone combinations. Mirena and Skyla, that's inserted directly into the uterus. So provide two advantages of progestin-only oral contraceptives. One is the reduction in side effects such as headache and elevated blood pressure, and alternative for patients in whom oral contraceptives are contraindicated. Pregnancy and childbirth. Pregnancy tests and pregnancy. The benefits of early pregnancy detection include earlier prenatal care, earlier detection of an ectopic pregnancy, and more time for counseling. Home pregnancy tests such as First Response or Clear Blue, they're based on detection of human or the HCG hormone, which is indicated by a color change, and they can detect pregnancy after the first day of the missed period, so they're pretty early, and results are available in 1 to 5 minutes. Some specific nutrition, which is advised for sexually active women, include a daily requirement of folic acid, iron, and calcium. These are different drugs to induce labor. Oxytocin is probably the most common one that you'll be given in the hospital to begin the induction of childbirth. And drugs used for premature labor or to stop the contractions are magnesium sulfate and Procardia. Osteoporosis. We've all heard of that, I'm sure. The bone is living tissue and it's constantly replaced. So osteoclasts resorb bone while osteoblasts form bone. And opposing activities of osteoclasts and osteoblasts balance in normal bone. Osteoporosis is the condition of reduced bone mineral density, which is disrupted. It disrupts the microarchitecture of bone structure and increased likelihood of fracture. It occurs as a result of a deficiency of estrogen, calcium, and vitamin D. It can cause hip fractures in the spines and wrists. Risk factors include being a female, Caucasian or Asian ethnicity, family history, small body frame, smoking, heavy caffeine intake, and poor nutrition. One way you can detect it is a bone mineral density machine, or a BMD machine. It uses x-rays and ultrasound technology to measure bone density. Your T-score is a score that's reported from a BMD test, and it estimates a risk, but it's not a diagnosis. Lifestyle changes to decrease risks include weight-bearing exercise or working out, foods high in calcium, smoking cessation, and a reduction in caffeine intake. These are drugs that are used to treat osteoporosis. Fosamax and Actonel are ones that you'll see very often in a retail setting. They're usually just taken either once a week or once a month. A selective estrogen receptor modulator, or SERMs. Avista is one of those, and raloxifene it's used. It works as an estrogen receptor by mimicking the beneficial effects of estrogen on bone mineral density. And other osteoporosis medications include calcitonin, denosumab, and Forteo. Adrenal gland disorders and corticosteroid therapy. Adrenal hormones include adrenal medulla and adrenal cortex. Those are parts of the gland, and then the hormone they produces are epinephrine and adrenaline, and then the adrenal cortex produces corticosteroids. Addison's disease is a life-threatening deficiency of glucocorticoids and mineralocorticoids. The symptoms include debilitating weakness, hyperkalemia, bronze color of skin in certain areas, low blood sodium, low blood glucose, low blood pressure, and weight loss. And the treatment includes daily administration of a corticosteroid. Here we discuss corticosteroids, how they work, and their side effects. Cushing syndrome, on the other hand, is an overproduction of steroids and excessive administration of corticosteroids in adrenal tumors. Symptoms include protruding abdomen, round puffy face, fat deposits over the shoulder blades, and treatment is surgery to remove the tumors and chemotherapy drugs to treat tumor and suppress corticosteroid production. If you are taking just a supplement, like an injection or a tablet of a corticosteroid, and you develop Cushing syndrome, just stop taking the medication. Will actually help the symptoms decrease. My older sister actually had this happen. She had a prolonged regimen of prednisone, and she ended up with Cushing syndrome and had a very round, puffy face. And after a few weeks of stopping the prednisone, that subsided. Diabetes is characterized by elevated blood glucose, which is due to insufficient secretion or use of the hormone insulin. Insulin actually maintains blood glucose levels. A normal level is about 100 milligrams, and levels consistently above 140 to 160 is associated with long-term effects of diabetes. It can also damage a lot of your organs and your eyesight, kidney function, and peripheral circulation. So type 1 diabetes occurs most commonly in children and young adults, and patients aren't able to produce insulin and are insulin dependent. Type 2 diabetes, most patients are over 40 years old, and the main issue is insulin resistance. Most patients are overweight, and the best treatment for that is weight loss. Gestational diabetes occurs during the second and third trimesters of pregnancy, and it increases the risk of fetal morbidity and death. It's usually treated with diet, exercise, and insulin. And symptoms of diabetes include frequent infections, presence of glucose in the urine known as glycosuria, hunger, increased urination known as polyuria, excessive urination at night known as nocturia, numbness and tingling, slow wound healing, thirst, visual changes, vomiting, weight loss, easy fatigue, irritability, nausea, and ketoacidosis. Complications, retinopathy, neuropathy, vascular problems, dermatologic problems, and nephropathy. The treatment of diabetes includes attention to diet, especially with type 2 diabetes, blood pressure control, compliance with medication regimen, control of hyperlipidemia, daily foot inspections. You're prone to sores and ulcers on your feet. increased physical activity, learning to recognize hypoglycemia, monitoring progress at home through blood glucose testing, monitoring progress at the doctor's office through glycosylated hemoglobin, patient education, prompt treatment of all infections, and setting individual goals. Insulin is a main treatment for especially type 1 diabetes, but also type 2 diabetes that is not controlled with oral supplements. It works by maintaining steady blood glucose concentrations, but a major risk of insulin is having hypoglycemia, which is if you take too much insulin, your blood sugar could drop significantly. There's different forms of insulin. So inhaled regular insulin is Afrezza. That one is actually rather new to the market. Novolog and Humalog are injections, and then Humulin R and Novolin R are regular insulin, which are also injections. It's very easy to grab the wrong type of insulin from the refrigerator. Always double check insulins because they look alike. All types of insulin are designated as high alert medications by the Institute of Safe Medication Practices. There's also different incretin therapies, such as Trulicity or Victoza or Simlin, that are used to treat diabetes. Here's some more of the gliptins. So if it ends in GLIPTIN, those are most likely going to be used as incretin therapies for diabetes. Metformin is one that you're going to see very commonly that's used a lot in type 2 diabetes. Sulfonylureas like Amaryl, Glucotrol, Micronase, those are all very common. Actose and Avandia, these directly decrease insulin sensitivity. Those are also pretty common and commonly dispensed in a retail setting. They can worsen heart failure though, so they're not your first line of defense against diabetes. Invokana and Farxiga, these are newer ones. They're in a drug class called sodium glucose-linked transporter 2 inhibitors. And which diabetes treatments increase the risk of hypoglycemia? That would be insulin, all types of insulin. And growth hormone deficiency. Growth hormones play a fundamental role in metabolism. Different things cause deficiency, such as intracranial infection, skull fracture, radiation, and cancer. And the treatment for those deficiencies are somatropin, and it's most effective when started at a young age. The catch-up growth experience is 80 to 90% of patients, and the maximum growth within first 6 to 12 months of therapy, and the minimal response after epiphyseal fusion. Complementary and alternative therapies for female hormones. So soy, black cohosh, evening primrose oil, and wild yam. Soy is found in tofu and then soy milk, and that's recommended for treatment in a lot of menopausal symptoms. Therapies for diabetes, chromium and cinnamon. Cinnamon is shown to have potential benefit in one study, but then little in later studies, and it's not supposed to be taken by patients with liver disease. Osteoporosis can also be treated with over-the-counter calcium with vitamin D. Our chapter summary. Hypothyroidism is treated with levothyroxine, liothyronine, or thyroid extract, whereas hyperthyroidism is treated with propylthiouracil and methimazole. Erectile dysfunction is treated with sildenafil, tadalafil, or vardenafil. The risks and benefits of HT differ in each woman. HT is hormone therapy. Hormonal contraceptives are available in pill form, patches, rings, and implants. Biophosphates are commonly used to treat osteoporosis, and complications of diabetes include retinopathy, neuropathy, nephropathy, and vascular and dermatologic complications.